Urgency of onset, acute versus chronic, can be insidious. Kidney failure, when it unfolds acutely, can be a medical emergency requiring immediate attention. It can arise due to sudden severe events such as a massive blood loss or intake of substances toxic to the kidneys. Symptoms like reduced urine output or swelling due to fluid retention signal its onset. Contrastingly, chronic kidney failure develops slowly, often over years, as the kidneys gradually lose function. Conversely, a rash could be a sign of various conditions ranging from benign allergic reactions to severe infections. While some rashes appear suddenly and are swiftly noticed, others could insidiously hint at systemic or chronic issues like autoimmune diseases or even chronic kidney failure itself, when toxins accumulate, affecting the skin. The timing and evolution of the symptoms play a pivotal role in clinical assessment and intervention strategies. Affected system, renal versus dermatological. Kidney failure and skin rashes may seem unrelated at first glance, but there is an intriguing connection through systemic diseases. When the kidneys fail, waste products accumulate in the blood, which can lead to uremia. This condition can manifest as a uremic frost, where urea crystallizes on the skin, causing itching and rash. Moreover, some kidney diseases have immunological origins, like lupus nephritis, where the immune anomaly simultaneously attacks the kidneys and the skin, producing rashes. Understanding the interplay between renal and dermatological symptoms is crucial for clinicians looking to untangle the root cause of these manifestations and provide a holistic approach to treatment. The presence of both symptoms can be a red flag for systemic diseases and demands comprehensive evaluation to pinpoint the appropriate therapeutic strategy. Primary symptoms: fluid retention versus skin lesions. Kidney failure often manifests through fluid retention due to the kidney's reduced ability to remove excess water and waste from the bloodstream. This can lead to swelling in the legs, ankles, feet, face, or hands, a condition known as edema. Fluid retention can exacerbate blood pressure and overwork the heart, potentially leading to other serious health issues. In contrast, skin lesions such as rashes are typically symptomatic of dermatological conditions or immune system responses. Rashes can indicate a variety of issues ranging from allergic reactions to autoimmune diseases. It's crucial to note that while skin lesions are primarily external, visible indicators, fluid retention reflects internal body processes and could be symptomatic of systemic failure such as in the renal system. Identifying the nature of these symptoms is essential for clinicians to pinpoint the underlying condition, be it renal impairment or an issue related to the skin or immune system. Urgency of onset, acute versus chronic, can be insidious. Kidney failure paired with a rash indicates a systemic process requiring immediate medical attention. Acute kidney injury, AKI, might present suddenly, manifesting through symptoms like reduced urine output and fluid retention. An associated rash could point towards a vasculitic process, such as Henoch-Schönlein purpura or systemic lupus erythematosus, SLE, each compelling rapid clinical intervention to prevent long-term damage. Conversely, chronic kidney disease, CKD, evolves over months to years, often silently. Chronic conditions might result in a rash due to accumulated toxins affecting the skin. Discerning the urgency hinges on tracking the timeline of symptoms, with acute scenarios often demanding emergent care to avert irreversible renal injury or severe systemic complications. Underlying causes: metabolic, degenerative versus allergic infective. Kidney failure and associated skin rashes can pose a diagnostic challenge, as they cross the boundaries between metabolism, degeneration, and potential allergic or infective triggers. When the kidneys fail to properly filter waste, the buildup of toxins can manifest as pruritic skin rash or uremic frost. Conversely, rashes might signify an allergic reaction or a systemic infection that could aggravate or be a sign of kidney impairment. Differentiating between these requires a thorough patient history, lab tests to assess renal function, and possible skin biopsy. It's a clinical puzzle where each piece, from serum creatinine levels to the appearance and distribution of the rash, informs a larger picture of the patient's health, guiding towards a precise diagnosis and tailored treatment plan. Common treatments: dialysis, transplant versus topical medications, systemic antihistamines. In managing kidney failure, dialysis is a life-sustaining treatment that filters toxins from the blood, compensating for the kidney's lost function. In severe cases, a kidney transplant may be considered as a more permanent solution. On the other hand, a rash often requires a vastly different treatment approach, typically involving topical medications to alleviate skin irritation or systemic antihistamines if the rash is allergy-related. The disparity in treatment complexity between the two conditions is stark. One requires high-tech machinery or organ replacement, while the other usually calls for simpler pharmacological interventions. This contrast highlights the specificity of medical treatments tailored to the pathophysiology of different diseases.